I'm David Mason, the Director of Public Health for the town of Sandwich, and we're here doing PSA number 8 for the second wave. And as we always do, we're going to start with Chief Burke for an update on our statistics.
All right, good morning, Dave. As of today, December 30, 41 active cases in town. The recoveries are north of 280. I don't have the exact figures. Hospitalizations are way up 50% from last week, 57 people hospitalized between Cape Cod and Falmouth. 3 of those are Sandwich residents. 9 are in the ICU. It's a 7 and 2 split, 7 at Cape Cod and 2 at Falmouth ICU. So significant aspect here is the 50% increase in hospitalizations over the last week.
Let's just grab that for a minute, because I think so people understand, because we're providing these statistics after Christmas. These statistics have nothing to do with get-togethers at Christmas. This is still the rollout from Thanksgiving and the weeks after Thanksgiving. And so we have yet to see the results of Christmas. We should start seeing that really next week.
I would think, and I think the amount of positive, well, as you know, we get the notifications, are 7, 8, 9, 10, 11 a day coming in. I mean, that's significant. We went days in the summer with nothing. And they are just rolling in, and they are all ages from 1-year-old, which we had 2 today, all the way to 80 years old.
Yep.
So community spread definition, here it is.
We're meeting it.
Yep.
So again, you know, as far as when we speak to the protocols, as far as social distancing, you know, facial coverings and keeping out of group settings, the town hasn't been following it, and that's the direction we're going in. And we're not going to shame people. We're not going to point fingers. But here's the deal, people. As far as we're starting to put a burden on the system, and we need to start to realize that and behaving differently at this point. Do you have any updates on testing?
So the 2 sites are operational, the Melody 10 site, which had a slow beginning. Things are picking up there, and you can register online to get tested there, and also at the fairgrounds. Barnstable County Fairgrounds and Falmouth. There are some restricted times with the fairground site in Falmouth. I think it's 2 days a week. And then they are working on the Outer Cape Health site. But again, at least those 2 initial sites are operational and starting to at least decompress some of the other testing centers. The
phone number for those sites, it's 508-534-7103. You do need an appointment, so you need to plan ahead. It's not like you're going to give a call and get a test that day. The pricing test cost is $75, and it's $110 for travel-related tests. Here's a suggestion. Don't travel, okay? Because it's starting to get a little frustrating with the volume of calls that we're seeing, the number of runs that we see at the fire department, and the number of cases we need to follow up at this point in time. There's been discussion out there, and you've probably seen it on the news, of a variant of the virus that has a 50 to 70% greater transmissible potency associated with it than the virus we've seen. So we're probably going to see more cases if the behavior continues the way it's going at this point. Just as far as where we're at with contact tracing, just within... To date, we've probably followed up with almost just shy of 2,000 people in terms of contact tracing for quarantining people in isolation at this point. Again, it means too many people getting together, too many people not following the protocols at this point. As far as we speak to phasing and vaccine, you want to speak to that where we're at this point?
Yep. So the main healthcare facilities in town here. Spalding started their vaccination program 10, 11 days ago. Cape Heritage and Decatur House are contracted out by CVS Walgreens through the state. I was told Cape Heritage will start vaccinating residents there January 13th. That falls in line with what we're seeing. Public safety, we're preparing for January 11th that week to do, and we're doing an Upper Cape partnership with Falmouth, Mashpee, Bourne, Sandwich, and the Joint Base Cape Cod Fire Department. 258 first responders broken out into 3 groups over a 4-day period. and we're going to utilize the Human Services Building just like we did in the spring with testing. We're flipping the same plan, but now we're using it for vaccines. So we're hoping by second week of February, both shots will be done, and public safety will be taken care of. The sooner we get public safety taken care of, the sooner the other phases move up. And I think that's important, and that's one of the things we've been striving for. Our plan was ready the second week of December, and again, we're ready to execute it. We can execute it tomorrow if need be, but what we're being told on my latest call this morning was to plan on the week of January 11th. I'll also mention on testing, school staff reentry testing is January 4th and 6th. We're going to concentrate on intervention specialists and special ed instructors on Monday the 4th, and then we're going to do the rest of the school staff on Wednesday the 6th. Gives us time if they need a nasal PCR follow-up. We'll have the results by Friday. The school can plan staffing accordingly. We did push for that on December 10th with the school committee meeting. I'm glad we did. It's all falling into place now. At least we can get a good
Yes,
read
it is.
on making sure staff coming back in the building are hopefully COVID-free, and then we'll see where things go from there. But so far, so good. It's going to be a busy month. The worst of the pandemic is here. I think you'll see it over the next 3 weeks. My only thing to people is I know people are fed up. There are some people that have given up completely that I have seen and talked to, but we just need to hang in there for another month. I keep telling people that vaccine's going to start rolling out. This virus seems to act on an 8-week sliding scale if you've been tracking it. So Wisconsin was a good indicator in mid-October as to what was going on, and they're now on week 9, and they're seeing a significant decrease. We're looking at the middle of January. Hopefully with the combination of people stepping up for the next couple of weeks, the vaccine rollout will be in a much better position come February and March, and then we can concentrate on vaccinating the general public after that.
Okay, just to follow up on some of the chief's points. One, as far as the vaccine, public safety, they're in phase 1.
Correct.
So just to understand, as far as this is specifically phase 1 for public safety, that will be initiated. The plan is in place for that. The date, the provision of that vaccine is not for anyone else except for public safety personnel, being arranged by Chief Burke. We're looking at the age group of 65 or older in phase 2 at this time. The state is looking at February, but it depends how fast we move everything else along also. So we are fully aware of your interests. We've received calls. We cannot schedule at this time. We will be reaching out and providing a mechanism for that to occur as we go through the month of January with plans on addressing, getting your name and your address and your phone number, but we will be doing that in the near future at this point. As far as the current cases going on too, between Joanne Gake, the public health nurse, and myself, we're speaking with these people now, and there was some indication that the virus wasn't creating much of an issue, that it was probably a little less of a strain. Which does not seem to be occurring as much as Chief had noted the number of hospitalizations. And the people that we're talking to right now are really having a lot of respiratory distress. They're having some challenges right now, and the ones we're talking to, it's not some good stories out there. If I sound a little annoyed at this point, it is because I'm tired of having to reiterate this issue in speaking with people, hearing their stories, and then there's people out in the public that just don't understand how serious it is. And I cannot emphasize that enough. And I think that's what I have for today.
Yep, I think we're good. And again, emphasize Dave's point on the vaccination for the phase 2 group 65 and older. We are aware you're out there. We are working diligently on a plan to get you in the queue. I ask that you be patient. And we should have something here in the next week or so that we can at least start taking some names and start processing. Anybody that wants a vaccine will get one.
Okay, because I will say, we have a plan in place.
Correct.
And we have the mechanisms in place. We just have to initiate it, and it's about timing at this point. Just we don't want it to start too soon.
Correct.
So,
yep.
Very good.
There will be an inside vaccine process for the 65 and older group. The drive-through is not conducive in the wintertime. There's a lot of variables there that I think we don't want to worry about. We can deal with that in the springtime with the general population. So just know that the vaccine plan and the process is CDC approved. Joanne did a great job working on that. So we're prepared. We know what we're going to do. It's just a little bit of a timing issue. But everybody that wants a vaccine, let's emphasize that again, because we saw that in H1N1 in 2009. You got a ticket
Right.
when you were in line. Everybody that wants a vaccine is going to get a vaccine.
You know, and actually too, because your people have been certified to provide the vaccinations also.
That's correct. So we're one of the only departments where we have a standing medical order where our paramedics can administer the vaccine. They're the same men and women that were at the flu clinic, so they already have experience, and plus, as paramedics, they're doing intramuscular injections all the time in the back of the ambulance. So that expands our workforce, so we have at least a dozen on top of what Joanne can provide, and that's an important piece to this also, is personnel. You can have the vaccine, you can have a site. If you don't have the staff that's either healthy and competent to run it, you're going to have delays, and that's why early on we got our firefighters trained up and prepared, and having Dr. Bemis as the physician on board. Like I said, we are ready to go, and there's a larger plan on the county-wide for first responders that overlaps with ours, so we have some redundancy there, but I'm extremely confident we can execute this mission. It's just it's a timing issue right now.
Yep, it's just waiting on that vaccine, and I know I'm aware that we have the ability to turn around and be ready to go within a 24-hour notice.
That's correct.
So, so I think we'll close it at that. You have anything else, Chief?
That's it.
Next week we'll be doing PSA number 9. We're going to attempt to get Chip Riley in. He's the Deputy Emergency Management Director. As we start to get into storm season, we want to talk about sheltering, the issue with shelters during COVID, and how you need to plan for that also. So we'll be bringing Chip in on that. So have a good day. Please be safe. Be courteous. Smart people. Be smart. Thank you.
Thank you.